A hemorrhoidectomy is surgery to remove internal or external hemorrhoids that are extensive or severe. Hemorrhoids are highly vascular submucosal cushions that generally lie along the anal canal in three columns: the left lateral, right anterior, and right posterior positions. Hemorrhoidectomy, internal, by rubber band ligation, S. The physician performs hemorrhoidectomy by ligation of an internal hemorrhoid. The physician identifies the internal hemorrhoid. The hemorrhoid is ligated at its base, usually with a rubber band. The hemorrhoid tissue is allowed to slough over time. Hemorrhoidectomy, external, 2 or more columns/groups. Incisions are made around the hemorrhoids and the lesions are dissected from the underlying sphincter muscle and removed. The incisions are closed with sutures. Hemorrhoidectomy, internal and external, simple column/group. With fissurectomy. With fistulectomy, including fissurectomy, when performed, an incision is made in the rectal mucosa around the hemorrhoids and the lesions are dissected from the underlying sphincter muscles and removed. The incisions are closed with sutures. Report 46,257 if an incision is made around the fissure and the fissure is dissected from the underlying sphincter muscles and excised. Report 46,258 if the fistula is in the same plane as the hemorrhoid. A single incision is made in the mucosa around the lesions and the lesions are dissected from the underlying sphincter muscles and removed. If the lesions are in different planes, separate incisions are used to excise the lesions. If a fissure is present, it may be excised in a similar manner. The incisions are closed with sutures. Hemorrhoidectomy, internal and external, 2 or more columns/groups. With fissurectomy. With fistulectomy, including fissurectomy, when performed, the physician performs excision of complex or extensive internal and external hemorrhoids. Incisions are made in the rectal mucosa around the hemorrhoid columns. The lesions are dissected from the underlying sphincter muscles and removed. The incisions are closed with sutures. Myomectomy, excision of fibroid tumor, S, of uterus, 1 to 4 intramural myoma, S, with total weight of 250 grams or less and/or removal of surface myomas, abdominal approach. Myomectomy is the surgical removal of fibroids from the uterus. The physician removes 1 to 4 fibroid tumors from the wall of the uterus, intramural myomas, with a total weight of 250 gm or less and/or removes surface myomas by abdominal approach. A transverse incision is made in the abdomen, the anterior sheath of the rectus abdominis muscle is dissected, and muscles are retracted. Vasoconstrictors are injected and a tourniquet is applied to encompass the uterine mass and the adnexa to limit blood flow. A scalpel, electrocautery, and/or laser may be used to remove small surface myomas. The physician incises the uterus through the myometrium to expose the myoma, which is grasped with a clamp and dissected free from the surrounding myometrium with sharp and blunt dissection. The pedicle is isolated, clamped, and ligated, and the myoma is dissected down to the pedicular blood supply. Other myomas are identified by palpating the uterine wall through the defect created by the already excised myoma. Adjacent myomas are reached and removed by tunneling further through the initial incision to avoid additional uterine trauma. The uterine wall defects are repaired by approximating the tissues to restore previous anatomy. The serosa is closed so as to minimize adhesion formation. Anti-adhesion prophylaxis may be instilled in the abdominal cavity and the wound is closed. Myomectomy, excision of fibroid tumor, S. of uterus, 5 or more intramural myomas and/or intramural myomas with total weight greater than 250 grams, abdominal approach. The physician removes 5 or more fibroid tumors from the wall of the uterus and/or intramural myomas with a total weight greater than 250 gm by abdominal approach.